Listen to the scientists, the experts, and we put shots in arms. And together we conquered the pandemic and saved countless lives. Much of that work was done because of the incredible, dedicated, underappreciated by many, the staff here at Wadsworth. And I want to thank them always for being on the front line during those dark, dark days and the sleepless nights and long, long months of research and making sure we had supply of our vaccinations, but also what they're doing now. And I want to thank especially Dr. Leonard Peruski, our director, and I want to recognize him for leading an incredible team here as well. I'm also joined by Dr. McDonald, our Commissioner of Health. I'll be introducing him momentarily, and Catherine Garcia, the Head of State Operations. We're here today at Wadsworth because since the beginning of the year, New York has now reported 4 individual cases of measles. Now, this cannot be classified as an outbreak. We know how to handle this. We do not have another pandemic on our hands. But at this early stage, I thought it was important to sound the alarm to provide New Yorkers information and share our plan for stopping the spread of this disease any further. First, here are the facts. Like I said, we have 4 individual cases that we believe are unrelated, 3 in New York City, 1 in Suffolk County. Now, these numbers themselves are not inherently a cause for concern. And for example, in 2024, we had 15 cases, but nationwide, we're seeing very concerning trends, 350 measles cases around the country. 81% right now are part of an outbreak in West Texas. And of those sick in West Texas, 3/4 are unvaccinated. And also of great concern to us as a border state to Canada, there are 350 cases reported since last fall in Ontario, literally right across the border from our state. So the good news is we're alert, we're vigilant, we're watching, but also we have the power to stop any outbreak. It rests in our hands. Now, the measles vaccine is remarkably effective. According to the CDC, 2 doses of the MMR vaccine have a 97% effective rate. And this is available to all. Now, children get the shots, but also, if you're not sure if you had a shot when you were a child, you should see your doctor. Make sure that there's no danger in talking to your doctor about possibly getting immunized once again. And if you have your vaccination, the overwhelming evidence is that you'll be safe. It's the only thing to do. It's smart, it's responsible. For young people, the elderly, the immunocompromised, those are especially vulnerable individuals. So it's also not just protecting yourself, similar to the COVID vaccine, it's about protecting your community. And this is what the doctor will be speaking about momentarily as well. I know vaccinations have for some reason become a very divisive topic in recent years. It pains me to think that in the year 2025, that we're still debating whether vaccinations are safe, when in fact, the scientific evidence is overwhelming.